to today's episode of Holistic Health with Dr. Kate. My guest today is Libby Horish, a licensed acupuncturist, and Libby has a background in environmental science. She's cared for a wide range of health concerns as well as wellness for both men and women. And then just recently, Libby has completed her fellow in the American Board of Oriental Reproductive Medicine. So she has a very strong background and really only one of the few acupuncturists in Massachusetts that have this fellow, where she really focuses on a wide range of fertility and reproductive health concerns. Libby is the director of Nurture Whole Health and Reproductive Acupuncture, which is in Concord, and she is not only a health professional that is really passionate about what she does as an acupuncturist, but I know, Libby, that you have it kind of flow over into your entire life too, which is why we love having people like you on the show, because you're living what you're preaching and practicing, and that's really, I think, important. So we're really excited to have you on the show today.
Thank you very much. I'm excited to be here.
Great, good. So I wanted to talk a little bit about, I know acupuncture is known to help a number of conditions. If you could give sort of a small tutorial in helping people understand why acupuncture. I know the World Health Organization has recognized it for over 100 different conditions. Yeah. What is it that acupuncture looks at in helping these conditions, so many different ones, as well as specifically some of the fertility and reproductive concerns you see?
Yeah. So Chinese medicine as a whole is all about balancing your body. And so, we talk about, today we're talking about acupuncture. Chinese medicine as a whole actually encompasses a bunch of different things. It encompasses herbs, acupuncture, lifestyle, and everything. And so when we look at Chinese medicine, it's all about making adaptations to your life and your body to get your body more into balance. And so with acupuncture, what we're doing is inserting needles into the body on channels or meridians that flow through your body and actually impact the internal organs. That's sort of how we look at it from an Eastern perspective.
Okay.
From a Western perspective, it's actually really amazing doing acupuncture right now where we are in the world, because there's more and more research coming out from looking at acupuncture and Chinese medicine from a Western medical standpoint. And so it's amazing because what they're finding is that inserting needles into the body on these specific acupuncture points can help regulate your hormones. They can help with your body's response to pain, as well as physically sort of bringing blood flow and bringing blood flow to the body and reducing inflammation in areas of pain. In my practice, I see a wide range of different conditions. I would say the top ones are sort of pain management, migraines, and then obviously the reproductive medicine piece. Mm-hmm. And so,
Would you say it seems like now acupuncture from a Western perspective is being, I guess, more integrated into that? I mean, you'll see it in hospitals, and but there's still a difference in the Eastern approach versus the Western approach, and acupuncture really is based on that Eastern approach.
It is.
So, is one of the biggest factors with acupuncture is how, in an environment that's always changing, how do we work with the body to allow it to change with it in a healthy way, adapt with it in a healthy way? Is that a good way to just sort of describe what you were saying?
Yeah, that acupuncture sort of just helps you balance.
Yeah. With how
everything is changing. Yeah, and so
your environment.
When I have a patient that comes in with a certain problem, what we find from an Eastern medical perspective is that people have a tendency towards certain imbalances, and it could come from their lifestyle. It could come from almost like we don't call it genetic predisposition from a Chinese medicine standpoint, but we would probably think of it as almost like a genetic predisposition to certain imbalances.
Okay.
And so, what we're trying to do is figure out the best way to create more balance in the body, because when you have imbalance, you have things like pain, you have things like migraines, you have hot flashes, you get night sweats, you get and fertility issues.
Okay. And various pathologies or diseases.
Exactly.
So this is interesting that you mentioned something about in Chinese medicine we don't see it as a genetic issue per se, which I find really fascinating, because when we're examining, let's say, something out in the environment, and with your environmental science background, you probably have a little more eyes into this.
Yeah.
When we're looking at a large amount of any type of animal that I think there was one several years ago, and I can't remember where it was or when, but a huge amount of fish ended up on a beach.
Yep.
And they didn't say, let's look at the genetics of this fish to see why they ended up on the beach. They looked at the environment.
Right.
But when you talk about people, we think, where's the genetic fault versus what's going on in the environment,
Exactly.
which is such a different approach. So you mentioned in Eastern medicine, we don't mention it as genetics. And is that because of that reason? Is that because you are recognizing the impact that the environment has on the person?
Definitely, but at the same time, so there's in Chinese medicine, we talk about qi, which is like your underlying core sort of energy. And there are all different types of qi. You can talk about qi in a bunch of different ways. And there is something called prenatal qi that we talk about. And so your qi right now, let's say, is a combination of your prenatal qi and your postnatal qi. Your prenatal qi is actually what you get from your parents. It's your birth parents. It's what you get at the moment of conception, and that's really difficult to change. And then your postnatal qi is everything that comes after, and that comes from the food that you eat. It comes from the air that you breathe. It comes from, sort of that whole environmental piece of things. It can even come from, being exposed to too much cold or heat. We talk about that being an issue with sort of regulating the balance of your qi.
Okay.
And so there is sort of a genetic predisposition, but from what I find with a lot of my patients, and I can't say all of them, is that what we're finding in terms of imbalances and, issues that they're having, it comes more from that postnatal qi, which is, lifestyle, basically.
Day-to-day
yeah,
choices.
and sort of, that includes environmental exposures and everything else.
And one of the things that you talk about, it can never start soon enough with looking at this. Do you treat a range of ages? My mind sort of always goes automatically to children.
Yep.
And how important it is with the decisions we make as parents and what we're teaching them as habits.
Right.
So I think for our viewers, some of the questions that come up is, what can we do now? And it can start as early as childhood.
It absolutely can. And so a lot of times with children, I'll sometimes do a little more acupressure or even magnets on the acupuncture points, because sometimes they're a little squeamish about doing actual acupuncture. But like I said too, Chinese medicine's a system. And so a lot of times when we have kids, if I have kids coming in, we're trying to adapt things in terms of their whole lifestyle too. So you can start sort of looking at things from a whole Chinese medicine perspective, starting from birth. And I have with my own children. You as a parent, you sort of pick out different imbalances, and you're like, okay, so I think you're going to be better off probably, not eating maybe these certain things, and you might be better off eating these certain things. And so you look at it sort of from a very holistic view. But the amazing thing for me is I've treated children as well as like young teens, and the amazing thing with them is that they respond incredibly quickly and incredibly well to acupuncture, because in Chinese medicine it's all about, and I know you guys talk a little about this too, but it's when you're symptomatic, you're at a point where the imbalance is sort of so bad that you're experiencing symptoms, but children typically when they come to see me are not that out of balance yet,
Mm-hmm.
just because, they're not, some are, but, not completely stressed out and, have not sort of done kind of the wrong things to their body over the course of decades.
Yeah.
It's been maybe 10, maybe 15 years, you know?
Yeah. I love that you're saying this, because this is really important, because I hear time and time again the word fine. I don't know if you hear this word. We were actually talking about it the other day in our office, where parents will make choices of whatever it might be. And you might have another parent say, well, my child didn't do that and they were fine. I never did that and my child is fine.
Right.
But what they're saying, and maybe viewers can see this too, and it's for adults too, that when you're saying I'm fine, what I think you're saying, or my children are fine, what I think you're saying is we feel a certain way.
Yeah.
So when we're basing our health on how we feel and assuming that that's the description of our health, that's the indication of how healthy we are, then we could be missing the boat. And this is so important, because with children, they're not often symptomatic.
Right.
And when adults come to see you, they've been symptomatic maybe for a couple weeks, maybe for months, maybe for years. That could be someone watching the show right now.
Right.
And it's important to understand that in our culture, and you must see this, in our culture we're taught when you have a symptom, you have to fix the symptom. And across the world, in other cultures, they don't think this way. But in the US, they think this way. And so we decide that we're going to do something about a problem when we feel it,
Right.
when the problem was underlying for potentially since childhood.
Exactly.
So even that component of that wellness piece that you have in your practice is, why are you waiting to feel something?
Right.
When I talk about with heart disease and women, which many people may know this, and I think it's coming to light, that one of the first symptoms that a woman might know you have heart disease is a heart attack,
Right.
which is a classic example of waiting to feel something.
Yep.
So I love that you said that. That's so important for people to grasp.
Yeah.
Really good.
Yeah, it is. It is. It's like you have imbalance for a certain amount of time, and then comes the symptoms.
The overflow
Exactly.
of those imbalances.
Exactly.
The messages from your body saying, okay, I've had enough.
Yep.
So when you're going through a healing process with patients, you obviously dictate those symptoms, but you also dictate your findings as a practitioner in terms of where you're seeing those imbalances and where you're seeing balances change. And
Exactly.
okay.
Yeah.
Now with children, I thought that was interesting. One of my children saw an acupuncturist when he was just a couple of months old.
Yeah.
And I think with anything you can adapt from an adult to a child, and you mentioned that for children it may not necessarily be, there's different ways to access those meridian points. There's needles, but there's other ways to do it as well.
Exactly.
So what are some other ways? Can you describe that a little bit more?
So,
what if it's an adult who, do you ever find that one is better for an adult than others?
So with my experience and just with what I know, I find acupuncture to be stronger than maybe acupressure and the magnets that I would use. So acupressure is, instead of inserting a needle into the skin, you're applying pressure to the acupuncture points. And what it comes down to too is that when you're doing acupuncture, you're inserting the needles and sometimes keeping them in for 20 to 40 minutes. Whereas with acupressure, unless I had 10 people helping me, I couldn't stimulate probably all the points I would want to
At
for
the same time.
exactly for
Okay.
that amount of time.
Okay.
And so most of the time with adults, I'm using acupuncture, which is with very fine needles. The great thing is that pretty much across the board, whenever I have patients that come in, first of all, I have different sort of width needles, and everyone is so different in terms of their sensitivity. And so if I'm finding a patient is a little too sensitive, I'll go right down to my thinnest needles that I have. Whereas some patients, you put them in and they're like, I didn't feel that at all. Like, did you really do something? And then sometimes I'll use a little bit thicker needles, just based on people's sensitivities.
Okay. What are some of, you talked about migraines, and fertility issues and reproductive issues, which is a huge topic these days. I mean, you just see that coming to light more and more.
Yep.
I want to talk about what types of reproductive fertility issues, perimenopausal issues you might be seeing, but what is the thought process from an acupuncturist, from an Eastern perspective, and I know this could go into great detail, but what is the thought process behind why acupuncture benefits these people so much, these women?
So a lot of what I see in my practice is I get a wide range of people with fertility. Sometimes it's people that are actually already undergoing in vitro fertilization and they're looking to use acupuncture to support that, which it can be really helpful for. There's quite a bit of research coming out with regards to how acupuncture can actually make your success rate better with IVF, which is just awesome, because sometimes the best case scenario is Eastern and Western medicine working together. So, but I also treat polycystic ovarian syndrome, which is a hormone imbalance in the body where a lot of times people become anovulatory, they don't ovulate, and they have really long cycles. But I also get a lot of women that have unexplained infertility, and they've gone through the whole runaround, they've done every test you can imagine, and they just don't know why they're not getting pregnant. And that's a really hard, I have a lot of women that come in and they'll do the workups and they come back and they're like, I almost wanted them to find something wrong because I want there to be a way to fix it.
Yeah.
But in that situation, that's where I find Chinese medicine can be most effective. Because from a Western standpoint, there's just not anything they can pinpoint. And a lot of times I have these women coming in and right away I'm seeing imbalances from an Eastern medical standpoint. And from a reproductive health standpoint, we're looking at things like, the health of their menstrual cycle is by far one of the most important things we're looking at. In Chinese medicine, there's very specific sort of things that we look for a healthy menstrual cycle. And if we're not seeing those, that's where we start. The first goal is to regulate the menstrual cycle with these patients.
And I know you had a couple of stories on your website from some women who shared that very thing. Going through it, there was no one could figure out why. They were trying these avenues. So that's really incredible. Yeah. Now, do you find that you're seeing, if it's mom and dad, are you seeing both parents?
A lot of times, what I actually do is, a lot of times it's the women that are coming in first. I just think they tend to be a little more open to this type of thing, and I think for them, they need the emotional support when they're going through this. But what I do is, if I'm seeing the female, I actually offer a free consult and initial treatment to the male partner. Because it's actually for me, honestly, because if there is something that I see going on with him that I think needs to be remedied, I want to do that. Because if it's unexplained, it's unexplained. We don't know where the issue is. It could be him, it could be her. And so if we can work together and try to figure that out, and sometimes it's just a matter of getting them on herbs and having them come in for follow-ups to sort of see how they're doing with the men. But I do treat both, and I've actually had quite a few cases where we've been dealing with men with low sperm counts or sort of morphology or motility issues. And I had one case in particular that was awesome. His sperm count doubled in 3 months.
Wow.
It went from being low to being normal.
That's great.
Yeah.
Now, so is that sort of a typical time frame? And every
A few
person
months.
is different, right? So it just depends on what's going on, how long a problem's been there, what you need to work through.
Exactly.
But if you were to have an average time frame of just initially getting going, where even if you like to say, let's start this process and let's not step back and really look at how things are going until blank. Sometimes we even do that here.
Yeah.
We'll have this time frame, but we'll say we're not even going to think about what's changing until blank. You've had so much going on for so long. So is a 3-month time period where you step back and say...
3 months is exactly right. And for men, that's actually really important because the way sperm actually forms is it takes cycle. 3 months from start to finish. And then
so important.
Then with females, that 3-month time period is important because a lot of times within that time period, that's when like sort of the dominant egg will sort of come to light, and that's I think sort of the minimum from a female standpoint if we're looking at sort of more of an egg quality issue. That being said, most of the time women, especially if they've had menstrual cycles that are either painful or a lot of PMS, all of those things, they notice changes right away. They come back the first month and they're like, I didn't even know I was going to be getting my period. Like usually I have, usually I'm irritable, usually I have cramping, usually I'm tired.
So they already see that regulation starting.
Yeah.
Which is something a lot of women deal with aside from fertility issues in and of itself. So something that maybe viewers don't even know could make a difference.
Yeah, I see a large group of women who are sort of perimenopausal, where they're sort of getting a lot of hormonal imbalances, sort of maybe some foggy headedness, maybe even some anxiety.
Temperature, body temperature must be
hot
huge
flashes.
Because I know that's a big part of your analysis.
Yep, it is. So hot flashes, night sweats, those all are indicators of different imbalances. And they find great relief with it. And to be honest with you, a lot of it in terms of even the hot flashes, it goes back to sometimes stress hormones. And so even if purely we're just getting their stress level lower, they'll see results. Even if that's really the only thing that's kind of showing up as part of their imbalance.
So I have that in my notes as something I want to talk to you about, is this stress, because I'm seeing it in kids here in our practice. And I know you briefly said, kids with stress, but women are carrying loads of stress. Mothers are carrying loads of stress. Yep. Women in general are carrying loads of stress. Balancing it today, some of our viewers might appreciate balancing family life, balancing work life, trying to keep it all together, trying to make it successful, and all of these added stressors. So even someone who's just feeling that heaviness and that weight of stress, I can't emphasize enough how detrimental stress can be physically to our bodies.
Yep.
And could show up as other problems, when in fact it's just looking at that regulation. So is that would be something that would benefit that whole balance. I mean, when I think of acupuncture and women's health, that's one of probably the top 3 things I think about, is the stress women go through and how acupuncture can make a difference in balancing that response.
And it's incredible to me. So in Chinese medicine, stress creates physical stagnation in the body. We refer to it as actually liver stagnation. It sort of accumulates in the liver, I guess, in Chinese medicine. But symptoms of liver stagnation in Chinese medicine are PMS, migraines, and it's not, you can't fit everyone into just one box. Usually there are a couple different imbalances going on. But I mean, I would say 99% of the women that walk in my door have some liver stagnation. Yeah. Which is what and the biggest cause of that in Chinese medicine is actually lack of movement, as well as emotional stress.
Which are 2 huge. I think about mothers because, as you know, I'm a mother of 4 small kids, and I think about and as a mom to 2 young children, trying to balance it, find time to move yourself. Yep. It can be overwhelming sometimes, and I think young mothers are, all of us are under stress. Men, you're under stress too. You just sometimes choose to ignore it. We see it here too. Libby sees it. And sometimes it takes the women in your lives, whether it's mothers or sisters or friends or wives or whatever it might be, to kind of push you along to do something. Yep. They're definitely the big ones that wait for the symptoms, from years of stressors. But I think that's such a huge component for people to understand. So I'm really glad that you're bringing that up, because again, I think that's probably one of the top 3 things I think about when I see a young mother who's has just a blowout from being so overwhelmed and stressed.
Oh, absolutely.
Yeah. And it's interesting because commonly when you're under stress, you turn to food, alcohol, which are all stressors on the liver anyway,
exactly.
Right?
Yeah.
So it's interesting how we do the exact opposite then. How in Chinese medicine, or in other countries, can you talk about where is acupuncture one of the first sort of lines of defense that they go to there versus here?
So yeah,
we're opposite.
Interestingly enough, in China, when you talk about Chinese medicine, the first thing they think of is actually herbal medicine. And so in China, herbal medicine is actually more predominant and actually sort of their main form, whereas acupuncture almost acts as like an adjunctive. It supports it, basically. But in China, I think people are more apt to go with the herbs, whereas here, people are more apt to... It's funny because I never get someone who calls me that just says, oh, I want to try Chinese herbal medicine.
Yeah.
So here, it's a matter of, acupuncture is more popular than the Chinese herbal medicine. But in my practice, I integrate the two because that's where I find it to be the most successful for the most part. Sometimes if I'm just dealing with a pain or physical issue, like osteoarthritis of the knee or low back pain, chronic low back pain, sometimes I'm just doing acupuncture with them, but a lot of times I really do try to bring in the herbs because they're sort of made to work together. If that makes sense.
Well, you think about an entire circle of health and you have to pull from all these areas. One of the things that I noticed on your website you mention is you involve the acupuncture, you involve the Chinese herbs, nutritional counseling, lifestyle coaching, movement. So, which we were just talking about, right? So all of those things are a picture, and I mean we even talk about this here. You can't. Your body needs multiple avenues for health. It's not one thing that you pull from. Do you find that you're using, and I want to talk about some of the items that you brought, but do you find with most of your patients you're using acupuncture, you're using the Chinese herbs, you're discussing lifestyle changes? How can you not, I guess? Right?
Yeah, you pretty much have to. I mean, I almost look at it as if there's a reason your body's out of balance, and the acupuncture and herbs can help with all of that for sure. I mean, obviously, it's amazing what it can do, but if you're continuing on your unbalanced path, it's going to be an uphill battle. So we need to get to the root, and that's what's so important is getting to that root, trying to make sort of realistic lifestyle changes for people so that they can feel great and feel good and have energy and in some cases get pregnant.
This is how people need to think for health today, because I think there's a couple of different tracks, and you have to pull from different areas, and you have to look at you could be doing one certain thing within four walls of an office, but if you're undoing that, or your path is still one that's very destructive outside of that practitioner's office, that's not going to make a difference.
Exactly.
And it's so important to address that, and you hope that people are getting that in places, but I think in an office like yours, you're looking at that total picture.
Yeah, I mean, sometimes I'm giving my patients recipes and all sorts of things, and in Chinese medicine, nutrition is really interesting in that it's about balancing. And so, a good example is like if someone is cold all the time, like physically feels cold a lot, I'll literally tell them, like, and they'll come in, they'll be like, I eat so healthy, I eat salads every day, and I drink smoothies for breakfast, which, let's be honest, that sounds healthy. You're not like going to McDonald's eating, a McMuffin in the morning and everything. But for that person, that probably isn't the right path, because it's all really cold things. You don't, if you have a lot of cold in your body and you're adding more cold to it, it's just going to create more cold. Same thing with heat. If I have a patient that comes in and is complaining of hot flashes, certain foods and certain drinks create heat in the body. Coffee is a huge one. Coffee is super hot from a Chinese medicine standpoint. Even if you drink iced coffee, it's still hot energetically. Same thing with alcohol. And so, sometimes patients are coming in and they're like, no one's ever told me to not eat these foods. I mean, this is a healthy food, right? I'm like, yeah, fruit's healthy, but not every day and not with ice in a smoothie,
And there's so many different components to nutrition. You talk about we know where now there's such a big, talk about eating what's healthy, what's not healthy food wise, but it's when you eat it, it's how you're preparing it, it's
Exactly.
how your body's responding to it. There's so many other layers to nutrition.
Exactly.
So those are some of the things that you'll discuss with your patients and educate them on.
Yeah, and I give every patient a sort of dietary sort of things to try to incorporate more of, things to try to incorporate less of after their first appointment.
And do you have sort of some dietary guidelines for women with fertility issues, women with perimenopausal issues? You'll talk about those things and approach that with that list.
Yeah, and everyone is different. I'll have some patients come in and they could have the same Western diagnosis, PCO, like polycystic ovarian syndrome, let's say, but two totally different manifestations from a Chinese medicine standpoint. And so for some people, I'm telling them to do certain things from a dietary standpoint, and other people I'm telling them to do completely different things. And it's because in Chinese medicine, just because someone has the same Western diagnosis, that does not mean in Chinese medicine that they have, the same Eastern sort of pathology or diagnosis.
Because everyone has a different life path, so it's what you've experienced or what you've it's what you bring,
right,
that's causing the issue. And would that be sort of the same thought process and symptoms? So if someone watching this has a certain symptom or a certain disease, they have had a different health history that has brought them to that diagnosis versus their neighbor who has it and they have a different health history. So it's important, you're saying, to look at that health history and from an Eastern standpoint.
Absolutely, because what might be right for one person might not be right at all for another person. I think of it, if you can think of sort of two different types of people. So you have a person that comes in with migraines, let's say. We think of everything in Chinese medicine as stemming from either deficiency or excess. So you have a person that comes in with migraines, and just looking at a person in Chinese medicine, you can sort of tell whether maybe it's more of a deficiency type issue or an excess type issue. So in Chinese medicine, if I have someone that walks in the door who's really thin, has sort of pale skin, seems sort of low energy, and gets migraines, their pathology is more than likely going to be totally different than someone who comes in with sort of a bright red face, maybe a little more on like the overweight sort of end of things, and has like a sort of big booming personality. Their pathology would more than likely be different. It's a totally different thing.
Fascinating, because if they were to walk in a Western conventional office, they would get it, and a treatment was appropriate for that person. The doctor determined that a treatment was appropriate for that person. It would be the same treatment for this person and this person.
Exactly.
Right. This is really important because and then you may not be looking at all of the underlying causes too. So for someone watching this who thinks, even if they are getting that Western medical treatment, they can still incorporate this and see some of the changes, work with their doctor, because who says when I'm on 18 different pills I'm going to be the healthiest I've ever been, right? So working with your medical doctor and saying, what does my body need and what does my body not need based on some of these healthy changes that I'm making, could make a huge difference.
And I've had patients who, have been on certain medications that then, go to their doctor, work with their doctor, and can go down off of some of them or go off of them. I've had a lot of migraine patients who have been able to just go off their migraine medications with their doctor's permission. I never would ever sort of go above an MD's recommendation. But, when people start feeling better, they don't need certain medications potentially as much. And so, they're able to do that, which is really great.
Yeah. And the patients appreciate that too. They appreciate their practitioners working together for their best health benefit. So that's great. Now, you brought some items here today, so I wanted to talk about them too, because we talked about the Chinese herbs. And briefly, maybe as you're mentioning these, what is the difference between? We've had an herbalist on the show. What is the difference between Chinese herbs and other
sort of
herbs?
Western medical herbs? Yeah, just
you tell
general
me.
herbalist.
I mean, I don't even know how that approach is different or.
It's one of those things. Mostly all of the herbs that I use are traditionally Chinese herbs. Like they're from China, Taiwan.
Okay.
And it's, the way we do herbs in Chinese medicine is actually a little bit different than Western, because at least from what I know about Western herbs, I'm not an expert in Western herbs at all. But what I find is that we're using formulas. So this is a formula right here, and it has like 12 different herbs in it. And in Chinese medicine, all of these herbs work together to create the body's like an appropriate response in the body to, create or regulate imbalance and create healing and reduce symptoms and everything. And that's sort of the big key piece with Chinese herbal medicine, is that very rarely will you ever find a Chinese herbalist that just uses one herb, because there's a synergy. And that's sort of part of how we learn herbs in Chinese medicine, is there's a synergy between certain herbs that help decrease side effects of some herbs, help increase the potency of some other herbs. And so that's sort of one of the main differences, I think, with Chinese and Western herbs, is that for the most part you always use Chinese herbs in the form of like a formula.
So could someone get Chinese herbs other than an office, a professional office?
I would not recommend it. Actually, in Massachusetts and in a lot of states now, you have to have. So the schooling that I did was 3.5 years or so, and you can choose to do acupuncture and Chinese herbs with it, or you can just choose to do acupuncture. Interestingly, some schools don't even allow that anymore. Some schools you do have to do both, I think. But from my standpoint, in Massachusetts, you have to have gone to school for Chinese medicine, have a certain number of hours, as well as passed a national board exam in Chinese herbal medicine. And I think this is the key thing, is that herbs are strong. Herbs are stronger for the most part, I think, than acupuncture. Depends on the person, depends on the potency of the herbs. But you can do harm with herbs. And you need to go to someone who knows what they're doing. Because, just like anything, if it can do so many amazing things, if you're self sort of diagnosing and putting yourself on a formula that you just got off the internet, it's and some of these formulas are made for long-term use. Some of these formulas are made for short-term use, and unless you have that knowledge, it's sort of a slippery slope sometimes.
Yeah, I think today more and more with the internet, and more people are getting so much information and finding different ways. But I guess I'm with the thought process of you need to certainly find someone who understands and knows what they're doing when you're talking about this, because I couldn't agree more. I think you could do damage, and these could be very harmful if they're not used in the right way.
And the other piece of things too is, unfortunately, China, as we know, is not the cleanest place in terms of environmental health. There's a lot of pollution there, and one thing I always say is I make sure that all of the herbs that I use in my practice are tested for heavy metals, tested for microbials, any they're run through and made sure that they are really safe for people. And if you're getting them off the internet, or even going to just a shop that sells them locally, you don't know that. And that's important, especially with my fertility patients, because the last thing I would want to do is have them taking something that, might not be helpful for what they're trying to achieve.
I'm crazy about even the little trinkets that you get that has, have the paint on them and all of that. I mean, I go as far as thinking about those things.
I know.
So Now there's different methods. This must be the powder form.
This is a powder.
And then is this a
these are tinctures. Yeah.
Okay.
And so that's what I typically use. One of the two. Traditionally.
Does this say pediatric formula?
Yeah, this is a pediatric formula.
Okay.
This is for there's actually some gone because I've used it on my kids. It's for sort of a congestive cough is what I'll use it for with my kids.
Wonderful.
Yeah, and they're funny because they think that anything that they take is herbs.
Yeah.
So, we recently had to use some like Tylenol because my daughter had just had surgery, and she, after the surgery, we gave her some Tylenol. She's like, "Can I have some more herbs?" I'm like, okay. Yeah. I'm like, that's funny.
This is what they're used to.
This is what they're used to, exactly.
Right? Yeah.
And so
are these the things? Acupuncture, Chinese herbs. Is this kind of naturally where you'll go with your family first in healthcare, just sort of to do a scan of looking at that?
Yeah, for the most part. But I, like I've said, I believe in the integration of Eastern and Western medicine.
Yeah.
And it's one of those things where
they have this avenue.
They have
at their
this,
fingertips.
and we, and as you know, we do chiropractic as well.
Yeah.
My son was getting ear infections, and it was like night and day.
Yeah, huge. I was just thinking about that this
Yeah.
morning as I was preparing for this. Yeah,
That was awesome.
Yeah, that's great.
But I try to take a more natural approach to things, and it works out pretty well for us.
Yeah.
But we have our pediatrician that we go to, and
Yeah, and again, having that conglomerate of people in
a
your
whole community. That's really what you need.
It's huge. It's huge. I can't emphasize that enough. I see that over and over again. I see it with our family. I see it with our patients, that when you have all of those practitioners in your corner, you're only gonna improve your health.
Yeah.
Yeah.
And it's nice having all sorts of different sets of eyes to look at your case and take. Everything has a different approach, and to be able to look at it from a couple of different approaches is really, I think, beneficial for pretty much everyone.
Absolutely. I agree. Now, what are these over here?
These are called cups in Chinese medicine, and these aren't typically the ones I would use in my practice because what you do is cupping is.
I feel like I've seen it.
It's a form of therapy that you use for all different things in Chinese medicine. Actually, it's not only a traditional Chinese medical, Chinese sort of, you can even call it sort of a Chinese folk remedy, but it actually was used in like Eastern Europe and everything too. And traditionally how I think they used to use it was more for if someone was about to catch a cold, you would do this on someone's upper back. So how you would use these is you actually like create a suction by, flaming a cotton ball, a cotton ball that's on fire in there, and then sticking it on the person to create a vacuum. And what ends up happening is, some of the person's sort of skin and everything gets pulled up into here. I use a lot with women for neck and shoulder tension, and it's amazing what it can do. And you can put them on for about 10 to 15 minutes, and people come out and they're like, I can't believe how loose I feel.
That would be the women or men, women who come with the migraines, the headaches, the loads of stress in their lives. You must see it with fertility and reproductive issues. I mean, with everything that they have to think about and go through, the stresses gotta be high.
Yeah, it is.
Yeah.
And
so isn't that neat? Okay.
Yeah, and so it's really great in Chinese medicine. Pain is related to stagnation, things not moving the way they should, and what this can do is really get things moving it gets your blood moving, basically.
I was going to say it must encourage blood flow.
Exactly. And so that's sort of one of the adjunctive techniques that I'll use with patients. Most people seem to, it's a little bit strange the first time you have it done, but people really enjoy it.
Well, I think about the process of it and just what I know, and I can picture it happening and the relief you must feel from that. Now, if someone were to come for a first visit, what would that typical first visit be like in your office?
So a first visit is usually about an hour and a half long. Okay. The first half hour to 45 minutes, we're reviewing your case history, send you paperwork beforehand, and have you fill that out. Some people, it's about 10 pages long. Some people are like, oh my gosh, why do you need to know? I'm just having back pain, or I get headaches. Why do you need to know all of this information? But like we've mentioned, Chinese medicine is a combination of everything, and you have to look at the whole picture to be able to understand what the whole picture really is, you know. And so we'll go through their whole health history and then do an acupuncture treatment. And that's what I start with people, and then I'll typically give them some dietary recommendations based on traditional Chinese medicine. And then from there, usually, and I'll talk about this with patients, if it looks like they're going to be a good candidate for herbs, usually we'll bring that in a couple weeks down the road. Like to see sometimes just how people respond with the acupuncture first, and then bring in herbs if necessary, or if we're able to. With some patients, I don't do herbs because they're on sometimes too many medications.
That was going to be a question I had for you.
Like anyone on Coumadin,
concern.
I typically would not put on Chinese herbs. And then, some patients, I do treat people who are undergoing like chemotherapy for cancer treatment and everything. And sometimes we can bring in herbs, sometimes we can't. It just sort of depends on the scenario.
Is that pain management, digestive?
Yep.
Disorders?
Nausea.
Okay.
One of my closest friends from acupuncture school is actually a acupuncturist at Mass General. And she does she works in the outpatient chemo department, does acupuncture for people there who are getting cancer treatment. And she just said it's amazing how patients feel when they are getting, and that's where Eastern medicine working together. It's like you're going down the path of chemotherapy, and but that doesn't mean you need to suffer the side effects of it.
There's so many other avenues that can still be supportive for you, as well as the fertility issues and just in general anything. I think about, we talked about the migraines, but I mean there are so many
allergies,
other breathing issues. I know you had mentioned on there, and that's one of the things that we'll see here. And someone might say, when can I take my child off an inhaler? And I say, do not take your child off the inhaler. We need to work with your child's pediatrician, but that's that combination of coming together and noticing if things changing, noticing if you may not need it as much or whatnot, but having them blend that together and see those different approaches. That's great.
It's funny, when I first started getting acupuncture done myself, I had suffered from asthma through my whole childhood, and it was like exercise induced fall asthma, and it was sort of like at that point I hadn't had many issues with it, but right around the time I started acupuncture, I had a sort of a problem with my asthma. It sort of kicked back in, and I went that day to an acupuncture treatment, and I was like, oh, and my asthma was kind of kicking back in, thinking, I don't know if they can do anything about this. And it was like immediate. Yeah, I couldn't believe it. I was kind of like, wow.
Wow, yeah. That's huge.
Yeah, it's pretty cool. It's
more prevalent in children now, are breathing issues. So yeah. Anxiety is more prevalent, stress is more prevalent. Yeah, so that's really great. So if people want to get in touch with you, what do they need to think about? They could be actively having a symptom. It could be general wellness. Definitely fertility, reproductive, and perimenopausal is a large population that you see. But I know that you care for all members of the family for various health concerns we talked about. So if they want to be able to get in touch with you, maybe you could let them know how can they get in touch with you to see how acupuncture could help them.
So my office number is 978-660-4502, and my website is www.nurturewholehealth.com, and my email is libby@nurturewholehealth.com. So any of those ways you can definitely be in touch.
Great. Good. Well, I'm so glad that you got to come on. I love this approach. I love your information. I think it was so knowledgeable for our viewers. And I'm really grateful that you were able to join us today, so thank you.
It was awesome. Thank you.
You have been watching Holistic Health with Dr. Kate. We're dedicated to informing and inspiring you to make healthy and whole choices for your family. Thank you for watching.